I'm really proud to be here today because I think what I'm going to talk about today is collective impact. And this is really what Appalachian Sustainable Development and Second Harvest is doing today. As philanthropist and as a businessman, today we really want to see more bang for the buck in our investments in the community. There are a lot of agencies and organizations out there that are asking for our money, asking for our support. There's also lots of needs. So we have to find a way of prioritizing. We have to find a way of collaborating. In my work with United Way and what I'm seeing happening in Kingsport and Southwest Virginia and what we're discussing in Bristol is thinking about community impact. Think about collective impact in ways of saying, okay, let's invest in causes rather than agencies. Let's look at funding solutions, to problems rather than funding agencies. And so I'm going to go with my background in business, philanthropy, theology, and also being a former FFA member and officer back in my youth. I'm going to try to tie all those strands together. So what is collective impact? Collective impact is when organizations come together to develop a common agenda. This is what you're going to be doing this afternoon, and this is vitally important. So take that exercise very, very seriously. The next thing you have to have is shared measurement systems. Now this is where the challenge really begins. We have maybe 50, 60, 70 different agencies here. Every organization has a different set of priorities when it comes to measurement systems. But part of collective impact is going to be getting you all on the same page for a few key measures. And those key measures are derived from what you come up with as your common agenda. And then part of your common agenda has to be mutually reinforcing activities. And I think ASD is doing a great job doing that. Events like this, developing continuous communication is also important. And of course then backbone organizations. And this is really key because somebody has to be the quarterback. It doesn't mean they're the most important player on the field, but somebody has to be the quarterback. Somebody has to be calling the plays. And the other players have to recognize their support role and how important they are. And I think this is really what we're trying to do in healthcare with the merger between Wellmont and Mountain States. In case you haven't heard that, we're working on a merger. And the idea of that is to take what we've become is unintentional adversaries, to use system thinking language. And we decided that, we are duplicating resources, wasting money on marketing and other things that can be reinvested back onto a common agenda to address childhood obesity and diabetes, to address addiction and behavioral health, and some of those pressing needs that really are impacting our health and our economy. So again, having a backbone organization like ASD and Second Harvest, those are very important. So I'm going to take a page book from manufacturing and the corporate world. Back in the 1990s, there was a book written, The Goal, and it revolutionized the way we think in business. Because typically what happened in corporations, large and small, was that each department, each functional area, each plant or facility decided it was going to optimize what it was doing. Now that we found out through lots of research, what did not optimize the system. What optimized the system was breaking the key constraints. So let's think about this as far as what you're doing today. All of you are part of the system. All of you are important players in part of the system. But there are key constraints. So some of you are in your department, in your agency, are focused on the key constraints. Some of you are partnering with other agencies. But the idea is to break the key constraints. You can't do everything. You can't try to optimize and solve every single problem. You have to pick and choose. And this is where the common agenda comes from that you'll be working on today. And what we're really trying to solve is what is called wicked problems. This was a term that was devised in the 70s by a guy involved in the city planner, and also took out in operations research. My undergraduate is in operations management, so which is an offshoot of operations research. But it said that wicked problems are multidimensional. They have multiple stakeholders, multiple causes, multiple symptoms, multiple solutions, and they're constantly evolving. So what you're thinking about today, what you're talking about are solving wicked problems. These are problems that took over a generation to develop, and they're going to take over a generation to solve. I think it's really key that we recognize that that these problems are going to take collective effort. And that we're going to have to think about different ways to solve these problems, because as Einstein said, the problems we have cannot be solved using the same systems and the same processes that develop them. Okay, so we have to think very differently. And these are really social Gordian knots. And fortunately, though, these social Gordian knots are not those that we can cut. We have to pick apart. But I think the key here is that we work together on developing collective impact. We work together on deciding when we can intervene in the system. The earlier, the better. I'll give childhood obesity and diabetes as an example. When is the best time to intervene to prevent childhood obesity and diabetes? It is, yes. It's the third trimester. And there are programs like family nurse partnerships that help work with mothers at that stage to help them through life. And I'm going to talk just very quickly about transdisciplinary research, and that is where we bring people from different disciplines together to solve problems. It can't be just all of us who think, act, and are familiar with the same research and same science. We have to have different people at the table. And a good example of that again is in childhood obesity and diabetes. What is one of the biggest factors, the biggest measures that determine whether or not a child is going to grow up to be healthy? With health outcomes, you know what the number one measure is? Reading at grade level by third grade. So when we think through these social Gordian knots, these wicked problems, we sometimes have to think outside the box and think outside of our own disciplines and engage with other people. And I'll say this too: what I really feel ASD is tackling is the systemic problems of monoculture and monocommerce. Okay, I'm a greedy capitalist, but let's face it, there have been some side effects to the Walmartization of the world. I'm a big believer in supply chain management. But it's the same situation as monoculture. Monoculture has reduced the seed diversity in the world considerably. It's resulted in sick soil, and it's resulted in many small farmers not being able to compete. And from a theology standpoint, this is very important because a connection with the soil is something that those of us who are Christians believe began at the beginning of time. The Hebrew word for man is Adam. The Hebrew word for soil is Adamah. Okay, so there's a connection with man or people, mankind, and soil. So we have to reestablish that. And the same thing happens with economic diversity. We have to work on, as the speakers have been talking about, how to diversify our economy and think about it like being organic economic development. That will improve our economic soil. So thank you very much. I appreciate this opportunity and the good work you're doing.